Hello, my name is Juliana Chavez, and I did my CAS 490T senior seminar on depression in older adolescents caused by domestic violence. So, first thing is first, what is depression? Depression is a serious medical illness that negatively affects how you feel and the way you think, and also the way you act. Depression is a very heavy and complex topic to discuss, especially when an adolescent is unaware of their feelings and also how they can express them to others. It also can be caused by many different aspects of your life and focusing on one primary source. Depression caused by domestic violence can have developmental theories like behavioralism and psychoanalysis. Depression in older adolescents caused by domestic violence. This paper and topic I discussed was mainly focusing on children from the ages of 12 years old to 18 years old. In some research studies, it was older adolescents to also adulthood, but it does really tie it all together just because it could also start at a very early age. Depression caused by domestic violence will encounter many aspects of how domestic violence can bring in not only depression, but also different domains of how people feel when exposed to domestic violence or a victim. The main topic of this is focused on psychological health outcomes. Depression, anxiety, post-traumatic stress, isolation, shame, guilt, fear, low self-esteem are all different types of causes that domestic violence can encounter. In the first research article that I discussed, it was children exposed to violence. So they found that expressing feelings and looking for signs and indicators can be a great way to look for when working with adolescents. This can be different ways on just how you might see that they are exposed to violence at home. This could be children not having supplies that they need at home, food, or anything like that they're bringing to school. Also, if you see that a child might be very quiet, isn't really asking for a lot of help, it might be behind in school, it could just possibly mean something is going on at home. It doesn't necessarily all the time mean that it's violence, but there's something going on that could be a possibility of this. These signs can be shown in their psychological health outcomes, physical health outcomes, academic difficulties and failure, behavioral problems, delinquency and offending, and polyvictimized. This came from the Office of Justice Programs. Different races and also ethnicities were shown in the study. Different studies can also show that violence was in different higher of cultures and ethnicities. And this one, it was mainly saying that African American, Blacks, and also Native American adolescents over the lifetime was showing these physical outcomes and also psychological outcomes. Depression and suicide into adolescents from ages 12 to 18 years. Risk factors like stress can be a big part of your life, and also it can really take a toll on your body of bringing in the depressing thoughts and also possibly suicidal thoughts. A big stress that they found in this research study can be parents getting a divorce or also ending a relationship. Another one that could be tied into this is a diagnosis for depression disorder. This is also known as bipolar disorder. Conduct disorder is another risk factor for depression. This is also viewed in boys mainly. This is being in a state of depressing mood is also known as adjustment disorder. Post-traumatic stress disorder and the attention difficulty hyperactivity disorder is the last piece that follows into risk factor for depression. Restricting access to any weapons, firearms, along with alcohol or other drugs can help with the adolescent safety in and with if that the child does have suicidal thoughts. Working with adolescents, that's very important to know these indicators, because if it was something going on at home, you do want to take it further with talking to someone or even getting parents possibly involved. Adolescents dating violence experiences among with sexual minority youth. This research study talked about how adolescents are talking about their dating experiences, and some of them do talk about if they have experienced dating violence. So 541 sexual minority youth between the ages of 14 and 19 reported dating experiences. 68.4% of sexual minority youth reported experiencing some sort of dating violence. Those who experienced dating violence were more likely to report poor relationship quality and lower levels of intimacy and conflicts in their other relationships that they might have other than their romantic one. Adolescents who are in violent relationships are likely to engage in sexual behaviors and experience mental health problems, including depression and anxiety. Longevity trajectories of child-to-parent violence through adolescence. So this research study focused on child-to-parent violence, also known in the study as CPV, which is referred to physical or psychological aggression towards parents or guardians by their children. So this type of violence was kind of different from the other articles that I wrote about. This is the child having aggression towards their parents or guardians. This focused on gender, family conflict, and also aggression of all factors of small percent of CPV reporting. They found 3 different forms of CPV, kind of like in a triangle tier. The first one would be a very low CPV group, but this was comprised of adolescents who reported shallow levels out of all 3 points. The second one was labeled as moderate CPV group, who comprised adolescents who reported moderate levels of CPV at the first time point. And also lastly was the third one, and this was labeled the high CPV group which comprised adolescents who report high levels of CPV at the first point. Mental ill health and structural pathways to women's experience of intimate partner violence. So this study focused on women's experiences in violent partner relationships. This focused on women from the ages of 15 to 49. So this research study did talk about a little bit of older adolescents to also adulthood. They reported domestic abuse in the last 12 months of this research article, which was back in 2017. Women showed who experienced domestic violence also had a higher risk of depression than those who did not experience abuse at all. Along with this, cortisol, depression, and domestic abuse were all findings from this article, and also another article that will be talked about in a minute. Suggested that cortisol deregulation may be a risk factor for depression, primarily in females. Early childhood exposure to intimate partner violence and teen depression symptoms. This was mainly focusing on the different type of symptoms that you could look for when a child is exposed to intimate partner violence and also leading to their teen depression. Early childhood exposure to intimate partner violence and depression have shown symptoms in teen violence in the U.S. They highlighted the long-term impact of domestic violence on mental health and well-being, including the risk of depression symptoms in teenagers. Early childhood exposure to intimate partner violence can have a long-lasting effects on their mental health and well-being in adolescents, highlighting the need for early intervention and preventing efforts. This next article focused on a specific race and culture group in mental health survey They focused on Hispanic community, mainly Mexican Hispanic community. They investigated the reoccurrence of depression among Mexican adolescents as they transitioned into early adulthood. This involved 3,017 participants ages from 12 to 17 years at baseline, who were followed up at 4 times over 10 years. So this research study was just not done within months or even a year time span. It was done over a 10-year time span. These study resulted showed that the depression rate increased from 10.8% all the way to 21.6%. That's about almost 10-11% more over the 10-year span. These findings have significantly jumped increase in this treatment for depression in young adults. This also showed them the ways that they could either give very great examples of how they could give us certain ways to help with the community, or also what else we can do to just help them in the classroom and also in other aspects of their life. The last topic I will be talking about is the cortisol and development of depression in adolescence and young adulthood. This research article talked about meta-analysts examined the relationship between cortisol levels and the development of depression during adolescent and young adulthood. Depression is a common mental health disorder that affects individuals of all races and genders. They found that it estimated that over 3 million people worldwide suffer from depression, making it a significant public health concern. But not only that this is the case, that they also helped so many people, and they listed the cortisol levels of what it might be. They found that men specifically that had a higher cortisol level suffered from depression more. So out of all these research articles, it found it to be that there's different ways and there's also different topics and risk factors that children are going through, and also adolescence and adulthood it can be carried out from. It's important to know the signs. It's important to just research as much as you can and to see how you can help your children in the classroom, or also just children that you might encounter later in life. This was my topic that I discussed in my research paper, and that is all that I have for you. Thank you.